Patient support has changed significantly over the last year. In previous years, healthcare organizations are focused on meeting the needs of patients via MyChart, but within the last year, as they started to dip their toes in the telehealth virtual visit model, that was no longer an option. With COVID and the pandemic, it brought on an onslaught of a need for virtual visits. And so healthcare providers were forced to jump in full force to virtual visits. So as we look at how patient support has changed over the past year, it was a lot of healthcare organizations scrambling to come up with what are we going to do? How do we offer virtual options to our patients? And then how do we support that? So if you look at 2020, a lot of it was just trying to figure out the pieces. Let's get something together and push it out there for our patients so that we can support them. When you look at some of the roadblocks to virtual support in the past, you look at reimbursement, you look at technological challenges. Those things have sort of gone to the wayside. Those aren't necessarily roadblocks anymore. And now that we've sort of addressed some of the factors with that reimbursement, it's more appealing for providers to do this. And once you give patients a little taste of what that virtual visit looks like, and they can see, wow, this actually is pretty successful. This is convenient. I can get what I need in real time and still have a great conversation with my provider. That's going to be here to stay. Even as we start to see a return to clinics and hospitals, what we're going to see is that virtual visit is going to decline from what we saw in 2020, but there's still going to be a significant percentage of visits that are going to remain virtual. And so healthcare organizations need to figure out a plan for supporting this long term. It's been pretty amazing what providers have been asked to do over the last year and how they have 100% stepped to the plate and stepped up to that challenge. Because a lot of organizations put together an asynchronous type solution. So here's a platform that we're going to use to support telehealth visits. It's not going to integrate into our Epic environment. It's just out there and you go figure it out. And so what we saw is that these patients were joining their virtual visits and either couldn't get their audio to work, couldn't get their video to work, or some component wasn't working. And now the providers are being asked to do technical support in addition to the clinical support that they really need to focus on. And if those providers aren't knowledgeable enough or available to be able to do that technical support, the patient's now calling the clinic staff prior to their visit and saying, hey, I can't get into my virtual visit, somebody help me. And now once again, we're taking away healthcare providers to support a technical area where they don't necessarily have the knowledge to support that. But they've all just done a phenomenal job stepping to the plate. Now, as we enter 2021, healthcare providers are looking back at those solutions that they cobbled together and thinking, what is our long-term plan for this now? Because what we did worked. We needed to do something quickly. We were forced to enter the telehealth world very quickly. And now let's fine tune, what does that look like? How do we best support this going forward? How do we get our patients real-time support when they're having issues with their virtual visits? How do we improve satisfaction for our providers who are forced to do something that was maybe kind of an unknown for them? So as you look forward to 2021, a lot of that is going to be healthcare organizations coming together and figuring out what is our long-term support for this? Because virtual care is not going to go away. So now it's time to take a step back and figure out, are we using our resources wisely? Are there other areas where we can offload this type of support to so that we can get our healthcare providers back focusing on providing healthcare for our patients rather than serving as a technical support liaison for the patients as well? Outsourcing is always a challenging question, I think, for organizations to look at. Everyone wants to think that they can provide all of the solutions for their patients. I think what we've seen in the past year is that it's not possible to ask people to take on all of this. And so when you start to look at outsourcing, one of the big things you want to look at, is there a partner that can actually serve as a partner? Can they be an extension of our resources? So it doesn't feel to the patient like they're connecting with this outside resource. What does the cost structure look like? It has to be something that's cost effective. And I think that's really the driving factor behind outsourcing a service is, how much is it going to cost me? And when you look at patient support in particular, patients have questions 24 hours a day, 7 days a week, 365 days a year. And that becomes very expensive to put together a model to support them. But if you look to a vendor like PDS, who supports 24 by 7, 365 days a year, because we have such a large scale customer base, because we have such a huge number of resources doing this, it becomes a much more cost effective option versus having to staff a center to support 24 by 7. But not only with the cost, you need to find a service that's quality. There's a ton of competitors out there, especially when we look at the changing landscape of healthcare. We've seen other competitors dive into this market and say, well, this looks like a growing, emerging area. I want to get in on this. But they don't have the years of experience that PDS has. And so when you look at this, you have to find that quality. You have to find somebody that has been doing this for a long time and can offer the same quality that you were able to offer to your patients or better. And I think when you look at our history in supporting customers for over 15 years in this area, there's not a lot of other organizations out there that can say the same.